Om Sai Ram. I offer my loving pranams at the divine lotus feet of our Lord Sai. Welcome to the November 2022 health webinar on the topic of men's health. We have three presenters today. Sanjay Vaja is a chemical engineer by profession and works as a quality assurance manager. He is the current regional president for Region 5 and also the Bal Vikas coordinator for Sai Centre, Greater Manchester. Sanjay has been an active member of the Sai organization for over 20 years, holding different regional positions. Professor Harish Thampy is a general practitioner and professor of medical education at the University of Manchester. Professor Thampy has been involved in the Sai Centre from a very young age and plays various musical instruments at Sai Centre of Greater Manchester. Previously, Professor Thampy has been the Region 5 president and now serves as spiritual coordinator for the Sai Centre of Greater Manchester. Dr. Harshul Measuria previously worked as a plastic surgery registrar in Oxford and is now general practitioner trainee in Gloucestershire. Dr. Measuria has been involved in the Sai organization from a very young age. Prior to working in Oxford and Gloucestershire, Dr. Measuria was an active member of Sai Centre of Greater Manchester and is also a keen musician. Jai Sai Ram.
Jai Sai Ram, everyone, and welcome to this month's health webinar on the topic of men's health. Before we start, I'd like to thank Swami for giving me the opportunity to talk a little bit about these very important topics this evening. So what are we going to cover in the health webinar? We'll talk about prostate cancer, testicular cancer, and then we'll have an input from Professor Harish Thampy about prostate and testicular problems. I'll talk about the Movember Family Man project and about a little bit about mental health, and then hand over to Dr. Harshul Measuria, who will talk more detail about mental health. But why are we talking about men's health this month? Well, many of you may have heard of the Movember project, where men are encouraged to grow a moustache during the month of Movember or November, however you want to call it. And the idea is to raise money for the charity, the Movember charity. And last year I took part with a team from work, and you can see my attempt at growing a very bad moustache last year. But while taking part in the Movember work, we also learned a lot about the projects that the charity has and the other important issues that they're trying to raise awareness of. So we'll cover those this evening. So let's start with a background into prostate and testicular cancers. So prostate cancer is the most common cancer in men in the UK, with about 40,000 cases diagnosed each year in the UK. And they reckon that 1 in 8 men will get prostate cancer at some point in their lives. And it mainly affects men over 50, and your risk increases with age. The average age for men to be diagnosed with prostate cancer is between 65 and 69. I have a little bit of information about testicular cancer. So it's a relatively rare type of cancer. It accounts for just 1% of all cancers that occur in men. And each year in the UK, there are about 2,300 men that are diagnosed with testicular cancer. It's unusual compared to other cancers because it tends to affect younger men. And although it's relatively uncommon overall, it's the most common type of cancer to affect men between the ages of 15 and 49. So it can affect men from quite a young age. And for reasons that are unclear at the moment, white men seem to have a higher risk of developing testicular cancer than men from other ethnic groups. So now I'll hand over to Professor Harish Thampy to talk more about prostate and testicular problems. Sai Ram.
Thank you, Sanjay, and Sai Ram, everyone. Before I begin, I just want to thank Swami for the opportunity for being invited to present in this health webinar. And in this section, I'm going to be covering prostate issues and testicular swellings. Now, I'm going to start with prostate issues, and we'll try to cover 4 key questions. What can go wrong with the prostate? When should we be worrying about a potential prostate problem? Should we be going to ask our GPs for a prostate blood test, the PSA test? And what else might be causing symptoms? So let's have a look at the prostate to begin with. As you'll see on the picture on the right, the prostate surrounds the urethra. That's the tube that connects the bladder to the outside world and through which we urinate. And the prostate itself, shown in the yellow in the diagram, is roughly the size and shape of a walnut. As we get older, especially into the 60s and 70s, the prostate naturally increases in size. And for this webinar, I'm going to be covering 3 main categories of prostate problems. The first is that age-related enlargement of prostate that I've just mentioned. But I'll also cover inflammation of the prostate, which can happen. And very importantly, and more worryingly, is cancer of the prostate. So let's start with enlargement of the prostate. And this condition is called BPH, otherwise known as benign prostatic hyperplasia. And it's very common. So roughly 1 in 3 men over the age of 50 will have prostatic enlargement. And as you'll see on the picture on the right, that kind of walnut size shape of the prostate has now enlarged on the right-hand side. And when that happens, a range of symptoms can occur. And this includes difficulty starting or stopping the flow of urination. Sometimes you might notice a weak flow of urine being passed. As you can imagine, that big prostate is squeezing the urethra and narrowing the flow of the urine out from the bladder, and therefore the flow isn't going to be as strong as it once used to be. Patients might find they need to strain to kind of force urination. You might not feel you're emptying your bladder fully, and that's because only smaller amounts are being passed each time. Patients sometimes complain of dribbling at the end of urination. Commonly, patients with BPH will go more often and sometimes more suddenly to pass urine. And that can also happen at night. So patients complaining of having to wake up 2 or 3 times a night in order to go to the toilet to urinate. So if you experience any of those sorts of symptoms, you must go and see your GP. And as a GP myself, I will start by taking a history and establishing the symptoms the patient is complaining of. And then I'll move on to do an examination. And there's 2 key parts of that assessment. The first is arranging for a prostate blood test, which I'll come back to later on. And the reason for doing that prostate blood test is to kind of reassure ourselves, me and the patient, that we're not missing something like a prostate cancer here. But the other key part of the assessment is what's called a DRE, and that's a digital rectal examination. And that's a very quick examination of the prostate. And we do so by having the patient lying down on their side. And then with a gloved finger, the doctor will feel up the back passage to feel the shape of the prostate. What we want to feel is a nice smooth prostate surface. What we don't want to feel is a very hard, knobbly prostate, because that can potentially suggest something more sinister like cancer going on. So if the PSA blood test is within normal range, and if the prostate on examination feels nice and smooth, then we're not concerned we're missing anything like cancer, and the diagnosis can be made of benign prostatic hyperplasia, the enlarged prostate. And in that situation, we have these following options. So for many patients, they may just choose to monitor the condition, not necessarily start any medication, but perhaps make some changes to lifestyle, especially around reducing fluid intake. Tea and coffee particularly are problematic. Some patients, however, find that the symptoms they are experiencing of going more often, the issues with the flow, etc., are quite troublesome and are impacting on their quality of life. And therefore, as a GP, we can start medication to help try and open up that flow. If you look at that picture on the right-hand side again, these medications can help improve the flow of urine out of the bladder and through the urethra. And actually, quite uncommonly, do we ever get to the stage of surgery? But that is an option, and that's for patients who have quite severe symptoms and who have not responded to medication. So we'll move on now to the second category of prostate problems, and that's inflammation of the prostate, otherwise known as prostatitis. And this is when the prostate gland, as you can see on the right-hand side, now becomes very inflamed and swollen. This is normally a condition of older men, often above the age of 50. And this time, the symptoms tend to be very much pain, especially in the saddle area, so that kind of area underneath where we sit. And that can often be worse when patients are sitting for prolonged periods of time. Pain when passing urine, again, a frequent need to urinate, and problems with urinating, for example, starting the flow of urine. And unlike the previous condition where you get the natural age-related growth of the prostate, and that builds up over many, many months, this condition presents much more acutely and suddenly. And if you ever experience any of these sorts of symptoms, then you would obviously make an appointment with the GP, who will do an assessment. And the kind of key approach to managing prostatitis is, number one, good painkillers, because it is painful. We often use antibiotics because as part of this inflammation, there can often be infection going on as well. And temporarily, we may also use medications to, again, open up the flow until the prostate settles back down and the inflammation has resolved. And then thirdly, prostate cancer, which is often at the back of the minds of the patients I see. Prostate cancer, as we heard from Sanjay, is one of the most common cancers in men, and like lots of prostate problems, tends to affect older men, particularly over the age of 65, though we are seeing increasingly that men over the age of 50 also developing potential prostate cancer issues. Now, there are some particular at-risk groups for prostate cancer. So looking at ethnicity, prostate cancer is more common in men of Black ethnicity compared to those who are from a white Caucasian ethnicity. Family history is also important, so the risk very much increases if you have, say, a brother or a father who developed prostate cancer under the age of 60. And there's some certain genetic familial conditions that, again, increase the risk of prostate cancer. So BRCA1 or BRCA2 or Lynch syndrome, these are all genetic conditions that increases the individual's risk of developing prostate cancer later on in life. So the symptoms of prostate cancer are shown here, and you'll recognize that a lot of these symptoms are very similar to the symptoms we saw when I was describing the benign prostatic hyperplasia, the age-related increase in size of the prostate. And that can make it difficult to initially tease the two apart. So again, we have patients who complain of needing to pass urine more frequently. That could be day or night, rushing to the toilet, difficulty in starting the flow, taking a long time to pass urine. Again, that issue with the weak flow or not feeling that the bladder has been fully emptied. But one of the kind of important differences is blood in the urine. Now, blood in the urine actually isn't often to do with prostate issues. Blood in the urine tends to be problems elsewhere in the urinary tract, for example, the bladder. But clearly, if you are noticing blood in the urine, that is what we call a red flag, something you must go and see your GP about. As I mentioned, the vast majority of these symptoms do overlap with BPH, and therefore, when it comes to the assessment, those same two things now apply. The GP will need to do an examination to feel the surface of the prostate. This time, as I say, if it feels hard and knobbly, that's more suggestive of a prostate cancer. And again, doing that PSA blood test, if that is raised, then again, it raises the possibility of this being a prostate cancer. So if either of those two things are concerning, then the GP would refer you urgently on what's called a 2-week wait basis to the urology specialists. And a variety of assessments will happen in the urology clinic. They'll obviously do a more detailed clinical assessment, but often patients are then put through for an MRI scan, and the MRI scan will then allow the urologist to identify particular areas of the prostate to sample through a biopsy, and that can obviously then help decide the eventual diagnosis. And if prostate cancer is confirmed, then a treatment plan is decided with the specialist. So I've mentioned this PSA blood test a number of times. And so should we be going to our GPs and asking for a regular PSA blood test? Should we be going every year and saying, oh, I want to just check and make sure I've not developed prostate cancer? So I'll come to that, but let's just think about what PSA is first of all. PSA is a protein that's made by the prostate gland, and we can measure it in blood. And although I've mentioned that we check PSAs in patients who are coming with symptoms of the prostate, so either symptoms suggestive of the benign enlarged prostate or symptoms potentially suggestive of prostate cancer, it's not a good test for someone who doesn't have symptoms at all. So in what we call in medicine a screening test. And the reason why it's not particularly good as a screening test for cancer is, as you'll see here, that around 3 in 4 men who have a raised PSA level will not have cancer. And 1 in 7 men who have a normal PSA blood test will have cancer. So it's misidentifying what is actually going on. What the NHS allows us to do is that although it's not a great test for someone who doesn't have any symptoms, you can, upon request, still ask for your PSA to be checked. And that for some patients can offer some reassurance, and if there is a cancer there, it can pick that up at an earlier stage. However, there are some downsides to having a PSA blood test done when you don't have any symptoms. It can provide false reassurance that there isn't anything going on. Or conversely, it might create lots of unnecessary worry and tests when you don't have cancer. And the third one is important to emphasize as well, is that you may find through the PSA blood test a high level, and it may turn out that you do have a cancer, but that cancer is very slow growing and would never have caused you an issue had it never been detected. The problem is once it is detected, then ultimately treatments have to be started and processes and pathways put into place to manage that cancer that potentially is all very unnecessary for something that would never have caused an issue in the first place. There are some groups, however, for whom regular PSA testing is advised, and it goes back to those 3 risk groups I showed you before. So people from Black ethnicities, those with a strong family history, so that's often defined, as I say, as a first-degree male relative with prostate cancer under the age of 60, or those with those genetic risk factors of BRCA1, BRCA2, or Lynch. And just to end this prostate section, is not all things to do with the waterworks are because of the prostate. Issues with the bladder are very common. So there's a condition called overactive bladder, where the bladder squeezes when it's not supposed to and can make people go more often to pass urine and give them the rush to go. Other bladder and other kidney conditions can obviously cause waterwork symptoms. The key thing I want to highlight, though, is if you have blood in the urine that you can see, then that is a worry and you should go and seek medical advice. And that's because 20% of patients who have visible blood in the urine are eventually then diagnosed as having a cancer somewhere in the urinary tract. But still, fortunately, that then leaves 80% of those patients who have visible blood due to non-cancer causes, what we call benign causes. That could be things like stones or other bladder or kidney conditions. And lastly, we're going to move on now to testicular lumps and swellings. And just to reassure everyone that despite the worry of feeling a lump or swelling in the testicle and immediately associating that with potential cancer, that's not really the case. Most lumps and swellings of the testicles are not caused by cancer. They're often things like cysts, which are kind of fluid collections, or varicose veins, what's called a varicocele in that area. So the advice from the NHS in terms of seeing your GP with testicular issues is if you do notice a lump in the testicles, if one or both testicles feel swollen, if there's been a change of shape or in the way that your testicles feel, if one feels or appears bigger than the other, again, see your GP, or aching or discomfort that isn't going away. If you develop sudden severe painful swelling in one of your testicles, that's really an emergency. There is a potential for that to be what's called testicular torsion, and that's where the testicle twists upon itself, and that can interrupt the blood supply to the testicle. And that is something that needs to be dealt with within hours in the hospital. So seek urgent medical review, potentially just take yourself up to the local A&E department to be seen. And lastly, I just want to end with encouraging self-examination of the testicles. And that's because if we get into the habit of performing this examination on a frequent basis, then we can identify changes early. Therefore, we can go and seek medical advice earlier. And if there is a cancer to be found, it will be caught at an earlier stage. So I've put the steps of this examination on the slide. It's really best performed after a warm bath or shower. That just softens things down below to make it easier to identify abnormalities. Stand in front of a mirror so you can see what you are doing. And the first thing is to examine and feel for any swellings of the scrotal skin. And so once you've done that, you then move on to examine each testicle one by one. So it's advised that you use your index and middle fingers on one side of the testicle and your thumb on the other. And you're very much kind of rolling the testicle between those fingers and thumb to feel for any abnormalities or lumps. Now, one testicle may be slightly larger than the other, and that's entirely normal, so don't be alarmed if you notice that. The other thing you'll feel, which again is entirely normal, is what's called the epididymis. And that's a kind of a soft tube-like structure that sits behind the testicle. And so once you've done this examination a few times, you'll get familiar with what it feels like and where it is. And therefore you won't mistake it for a suspicious lump. You may notice some lumps in the epididymis, and by all means do seek medical advice about that. But just to reassure, they are virtually never cancerous. But ultimately, if you are examining the testicles between your fingers and thumb and you feel any lumps, then please then book an appointment with your GP to get them to do a further examination and to arrange further tests. So I hope that's been helpful for you. I'm going to pass back to Sanjay and we'll take questions at the end. Jai Sai Ram.
Thanks, Harish. I'd now like to talk about the Movember Family Man project and a little bit about mental health. So Movember have this project called Family Man, which is spotlighting dads in particular And generally around the world, the rates of men and fathers participating in parenting programs are pretty low. And what the Movember team are trying to do is encourage sort of seeing parenting as a team sport and engaging more fathers to be involved. And they also say that about 70% of childhood behavior disorders occur in boys. So it seems to be pretty clear that boys could use a lot more support from their fathers. That's the main reason for the Family Man project. It's actually quite based on a lot of research that's actually done by a chap called Professor Mark Dadds, which is his real name. So he's the mastermind behind the Family Man project. And he spent many years, decades in fact, researching parenting techniques that look at promoting happy and healthy children, positively handling problems together as a team, and more dads getting involved. And he's worked with many hundreds of parents over the years and gathered lots of information. Obviously, dads are very important. It's a partnership raising children, but only about 20% of people who participate in parenting programs are dads. So Movember team would like to see that change. So that's why they created this project. So you can access it online, on your phone. It's fast, it's free. It's designed specifically for dads, although it's useful for mums and other caregivers as well. But it's designed for dads and it's research backed as well. So there's lots of evidence-based strategies and information from child behavioral experts, which is accessible on your phone or online very quickly to help you. I'd also mentioned about mental health as well, and Harshul will cover this in more detail. But in 2021, there were more than 5,000 cases of suicide, with 75% of those being men. And men sometimes aren't very comfortable opening up about any challenges that they may have, or they think they'll be burdening their friends. If there's someone you care about who you think is going through a tough time, which many people are with the COVID climate and work that's happening at the moment, they might not talk about it even if they want to. But the first step in looking after people or looking out for people is to reach out to them. You can't fix someone's problems, but you can be there for them. And sometimes listening is the most helpful thing that you can do. You won't make things worse by asking someone how they're doing. So the Movember team have come up with this scheme called ALEC. And it's 4 simple steps to help you have a conversation with someone who you think might be going through a rough time. So ALEC stands for ask, listen, encourage, and check in. You can start by asking how someone's feeling, maybe mention about any changes you've picked up on. So maybe they've gone a little bit quiet, or that you don't see them at social gatherings anymore, and just whatever. You may just be feeling that they're not themselves. And so you can start the conversation just by asking a question. You don't seem to be yourself lately. Are you feeling okay? And just trust your instinct, because a lot of the time, as we know, if someone says, I'm fine, quite often they might not be. So don't be afraid to ask again. You can mention specifics that you may have noticed. So it's quite a good technique. And what the team at Movember have done is on their website, they've given an area where you can practice having a conversation and practice using the ALEC methodology, if you like, and what you might say and what sort of responses you might get. So if there is somebody that you're a little bit worried about, I'd encourage you to go to the Movember website, look up this ALEC acronym and have a go. So I'll hand over now to Dr. Harshul Measuria, who'll talk a little bit more about mental health. Jai Sai Ram.
Thank you, Sanjay. Bye. Sairam, everyone. Good evening. Thank you for giving me the opportunity to share with you for the next 5 or 10 minutes my thoughts on mental health in men. May Swami accept my most humble pranam as I give this talk, and may he guide me and the words I share with you all this evening. So, one of the main mental health conditions in men is depression. So that's going to be the focus of my talk this evening. I'm just going to share with you some of the symptoms of depression, what can be done by oneself to try and help, what you can do if you're concerned about somebody else having depression, and what might actually happen if you go and seek medical attention from your doctor. because I know many men won't actually seek advice or help, often out of fear of what will happen if they do speak to somebody about it. So hopefully we can alleviate some of those difficulties for you this evening. So there's many symptoms of depression, as I've written here. Some of them mental, some of them physical, and some of them that men will have in a higher dominance than others. And I'll just spend the next few minutes talking through the different mental and physical symptoms that one might feel. So depression is a complex condition where people might find the mental symptoms more problematic than the physical symptoms, or vice versa, or a combination of all of them. The mental symptoms are often feeling unhappy, low in mood, finding you can't enjoy anything, having a loss of interest in things that you used to enjoy, either finding it difficult to concentrate on work or other activities that you used to enjoy, or having a lack of self-confidence to go about doing daily activity. There's often a feeling of guiltiness or unworthiness for either people's attention or their respect. And sometimes when the mental symptoms become overpowering, people can feel that they can start having thoughts of harming oneself, or thoughts of not actually being here at all, and thoughts of suicide. And really, if we can treat the symptoms early enough and identify them sooner rather than later, then the hope is that these kind of thoughts don't occur or won't start occurring. Obviously, we know that they're not normal thoughts, and one would hope that you won't act on them. But as somebody's depression becomes worse, there is always a risk that they're unable to fight the urge. And unfortunately, it can happen. And so we want to treat these patients before these symptoms, before it gets to that stage. Sometimes one might actually feel just the physical symptoms of depression, which can be restlessness or feeling nervous or agitated in social settings, either having no energy or just feeling exhausted all the time. Partly it can be related to difficulty in sleeping, or because they're waking up early or having a disturbed sleep. Sometimes it's related to poor nutrition and either undereating or overeating. You might find that people will either lose weight or gain weight if they are becoming depressed. As can often be the case, it might not be the person themselves that's even identified any of these symptoms, and it may be others picking up that somebody starts making more mistakes at work, or is unable to focus on their activities at work, or they become quieter, withdrawn, and avoid people or social interactions. Occasionally, they can become irritable or worry about things more than usual. Sometimes it might just be that somebody stops looking after themselves, either washing or cleaning themselves, or not eating appropriately. Or it may be that their environment starts to suffer and that they stop caring for their home and start living in a dirtier environment, which is different or not normal, often related to poor motivation to actually get up and do things. In men, the symptoms of depression can be slightly different from women, and you might find that they're more irritable than normal. They can have sudden bursts of anger or aggression without any triggers, or they start taking risks more than usual or out of the ordinary. Often men will end up trying to cope on their own in isolation rather than talk to anybody about their symptoms or their problems, and can turn to drugs or alcohol to try and control the thoughts that they might be having or how they're feeling. Sometimes it might just be that they throw themselves at their work and are working all of the time, and not able to interact or enjoy any other activities. And this could be a key symptom of depression for them. The main thing is to recognize that these symptoms may be developing and to act on them before they become worse. So if recognition is the key, if a person on their own thinks that they are starting to have symptoms of depression, first and easiest thing is to actually just talk to somebody about how you feel. Most people probably, most men particularly, will try and manage in isolation and won't open up to anybody about how they feel. But actually that can be the key thing. It's just to either find a friend or a colleague, perhaps a member of family, to speak to. And as Sanjay already alluded, the ALEC acronym, to ask, listen, encourage, and check in, is often very helpful when you're not sure where to start. Eating well is often a good start, and trying to get good quality food in will help you feel physically better. Sometimes if you're not motivated to cook, then you might find you'll be eating out more often and food that you're getting isn't as nutritious as it needs to be. Equally, if you're not motivated or you're struggling with how you're feeling, you might find that you're not able to be as active as previously. And actually just going for a walk in nature or going and playing sport with some friends might actually help you feel a lot better in yourself overall, to try and combat some of the way that you might be feeling. Avoiding alcohol and drugs is obviously going to help one to feel a lot better, because although they can dull down the thoughts and the feeling, they're only a temporary fix and obviously have negative physical and mental consequences of a way of patching up how you're feeling. Often in depression, the general feeling of exhaustion or lack of energy can be related to poor sleep quality. Now, eating well and keeping active during the day can often improve how you sleep at night, but equally having a sleep routine by dimming the lights, listening to some soft music before you go to bed, trying to avoid any screens and either from a TV or telephone stimulating your brain, say half an hour before bed, can have a significant impact, as can reducing caffeine intake after late afternoon. And then finally, doing something that you enjoy with friends often can really make you feel a lot better and give you a break from, one, how you're feeling, but also perhaps from work, which you may have become over involved with. And that can make a big impact on how you feel, and perhaps even give you an opportunity to share how you feel with people that you're interacting with. Now, in some circumstances, it may not be yourself that you're coming into contact with, or it may not be yourself that you're worried about, but it's somebody else that you've noticed that you feel that they may be becoming depressed. How can you help them? Well, the first thing is just to reach out to them and to let them know that you're listening, that you're there, that you're open to being able to discuss how they're feeling if they wish. Sometimes they might not be able to open up in the first instance, but checking in later on, either a call or a text, can have a big impact, just to know that somebody's listening, somebody is available, and at a time that might suit them, they may be able to approach you, knowing that you'll be able to lend an ear for them. There's quite a number of community support groups or talking therapies that are available widely throughout the community. Specifically for men, there's something called men's sheds, which are available in lots of different areas, whereby it's not specifically for people with mental health difficulties, but they're being created to try and get people try and get men who are in isolation together to be able to undertake activities such as woodwork or building things, which can often stimulate some sort of interaction and often conversation and create good relationships with people there, which, if somebody is in isolation, can often help them improve how they are feeling. And then finally, if you are worried about somebody, particularly men, they're less likely to go and seek medical attention or go and see their GP. So it may be that you can either encourage them to go and see their GP, or perhaps even take them to the GP or attend the GP with them. All in all, you just have to make sure that when you are supporting somebody with a mental health problem or with depression, it can be difficult to take on their burdens at the same time as managing your own life. So you have to ensure that you are looking after yourself first so that you can look after others. And obviously undertaking some of the activities that we've already discussed will help with that. And finally, what will happen if you do seek help? So if you were to attend the doctors, what's likely to happen if you say, oh, I'm feeling low, I think I might be depressed? Well, main thing is there's often a combination of therapy, be it medical and non-medical therapy, that is available. And the mainstay of treatment for depression is going to be talking therapies or thought retraining therapy, such as cognitive behavioral therapy or interpersonal therapies that I've listed there. And the main thing is to try and retrain thoughts to avoid negative ruminations. And the idea is to try and get on top of these negative thoughts to stop them spiraling out of control sooner rather than later. Often, if you are worried about somebody, either talking to friends, family, is often the key strategy here to be able to come out of depression and just be able to share how you're feeling, and then work on slowly motivating yourself to go about and get involved with activities that you used to enjoy. This is where the medication part of the treatment that a GP can help start for you can be helpful. So although the medication isn't going to fix how you might feel, it can help improve your ability to get motivated with any of these talking therapies. Some of them are things that you might have to do on your own. Some of them are computer programs or group sessions, depending on where you live. But the medication can often help just to give you that little pick-me-up before you're feeling quite ready to be able to get on with the other therapies available, because really it's not the medication that's going to help improve the depression. It is the other therapies that are available. So this is a quick whistle-stop tour of depression. Although I've tried to lean it slightly towards men, it does go equally for women, and so taking note of those symptoms, taking note of how one might feel, and actually just going and reaching out to help people and to talk about these things and how they feel is the first step to try and avoid the downward spiral that can occur with many mental health conditions. Thank you very much for listening, Sairam, and I'll pass over to Sanjay Bhai to summarize this evening's program. Thank you.
Sairam, thank you, Harshul. Before we go into the Q&A part of tonight's webinar, I thought it would be useful to have a brief summary of what we've heard about today. So we learnt earlier from Harish about the problems around the prostate, if it's enlarged, if it's inflamed, and also about prostate cancer. We also learnt about the importance of the testicular problems, examining and getting to know your testicles as well. We heard about the Family Man project from Movember, and we had a really good input from Harshul about mental health, signs and symptoms of depression, and what we can do about it as well. So there's different things we can do to take action, and I thought this slide summarized it quite well. It covers things around mental well-being, as well as the men's issues we've talked about today. So it's spending time with people that make you feel good, talking more, knowing the numbers and the stats around prostate cancer, getting to know your testicles by regular examination, and again, just becoming more active and moving more. And also, we thought it would be useful to share if you do need some support, or you're concerned, or you feel somebody you know is in danger, then these are the different things that you can do. If it's immediate danger, then you should call 999, or you can call NHS 111. There's a shout crisis text line as well. There's obviously the Samaritans, and there's a directory helpline as well, which you can find. And this signposting can be found from the Movember website as well. So if you give us a couple of seconds to get set up, we'll now go into the Q&A part of the call. Sairam. Okay. Sairam, everyone. That was a very informative presentation, and I think, keeping an eye on the time, we'll jump straight in with the questions. We've had quite a few good questions come through, so let's go. I think the first one's around prostate issues. So question number one, this will mainly for Harish, I think. I sometimes have symptoms like urgency to go to the loo, or some nights if I can't settle down, I need to go to the loo twice in the night. Is that normal? How often should you have symptoms before you get them checked out? Obviously, if you have blood in the urine, like you said, that's a red flag that need to get checked out ASAP.
Thank you, Sanjay. So I think that's a very interesting question. What's normal, and when should we start to worry? So the amount and the frequency that we urinate largely is dependent on how much we drink during the day and when we drink. So if we are having large volumes of fluid, especially late into the evening, then any of us with or without prostate problems will find we will need to go into the evening and overnight. So we need to think about how much we are drinking and when. But ultimately, if you are finding your symptoms are becoming troublesome in terms of having to wake up multiple times, it's not a one-off occasion, it's happening kind of most days of the week, then that probably isn't just down to your fluid intake. That may suggest there is something else going on, and therefore that would be the point to go and seek medical advice through your GP. The other part of that question is, when are those symptoms to do with the prostate, and when could they be to do with other parts of the urinary tract, such as the bladder? And that's quite a difficult question to answer, because obviously in a real clinical situation, I would be taking as a GP a full history, so exploring all of the symptoms the patient is describing. So not just how often are you going, but I would be asking questions around the stream and the flow, the starting, the stopping, any associated symptoms. We often use urinary diaries where we ask patients to fill in over multiple days how much they're drinking, how much they're passing, how often. And it's through those sorts of detailed assessments that we can start to unpick where we think the problem is happening. And as I mentioned in the talk, moving on to then examinations of the prostate and potentially doing some blood testing as well. So I think the kind of main take-home message is, if you are worried about the symptoms, it's persisting beyond just a couple of days, seek medical advice.
Yeah, that's pretty clear. Okay. One for Harshul now. How can I tell if I'm stressed or if I'm depressed? Are the symptoms quite similar?
Thanks. This is a good question, Sanjay. Symptoms of stress are likely to be stimulated by a specific scenario. It's not going to last for weeks on end. Symptoms of depression, as we've already discussed, everybody can feel any of those symptoms on an occasion, a day or 2 days, but it doesn't last longer than that. And most of us can probably snap out of it and carry on with normal life. If you are starting to become depressed, these symptoms continue for longer than a few days, a few weeks can go by and you still can't shake it despite trying some of the key features that we discussed already. And it starts having an impact on your day-to-day functioning. It's really at that stage when you can say, well, I'm not able to shake it. I'm not really able to move past where I'm feeling. And the trigger that caused me to be stressed in the first place is no longer there. And I'm still not feeling any better. So it's probably at that point where you could say, well, how I'm feeling isn't normal now. And that should probably talk to somebody about it. Yeah, and as we discussed, it might not be a medical professional immediately. It might just be a friend or family, and see if they can help you work things through. But it may eventually, lead you to going to see your GP about it.
That's one of the things that we kind of talked about, the stigma as well around mental health, and men don't normally want to talk about it. They won't go and see the GP. Is there any kind of best practice or any sort of suggestions that you've picked up along the way that you could share?
I think the key feature is particularly for men, is not to be worried about how people will perceive them if they're struggling with how they're feeling. Everybody struggles with how they're feeling, at some stage in their life, and it's not necessarily something you have to deal with on your own. And actually talking to somebody about it doesn't make you any weaker than anybody else. And it doesn't raise any other concern other than to say that I could just do with a conversation. I could do with a hand here. And having a non-judgmental conversation is really key to say, well, I'm here if you need me. And we can talk about whatever you wish, and it's just being open with those people. And for men particularly, it's a shout out to say, don't worry if you're talking about how you're feeling. It's okay. You're allowed. You don't have to be the strongest person all of the time. You don't have to carry everybody's burden all of the time. Sometimes that burden needs to be spread and needs to be shared. So be brave and, speak to somebody about it if you need to.
Also, if I may, Sanjay, just add in, very much agree with what Harshul has said. But I think also as medical professionals, one of our roles is to help try and normalize people presenting with mental health issues. So nobody comes to me embarrassed that they're coming about their high blood pressure or their diabetes. That is routine and normal. And mental health presentations should very much be the same. And I do my best as a GP, and I'm sure Harshul does the same, that when patients are coming to us, yes, I acknowledge and encourage them for having taken that step to come, but also then trying to normalize that consultation to make them understand that this is part and parcel of our health and well-being. We have physical ailments and we have mental health ailments. And that can again try and destigmatize this situation, very much normalizing it as part of routine clinical care.
Brilliant, thank you. There's a couple of things around PSA testing as well. So we've had one come through from the live chat. If PSA is not a conclusive test for Asians, then what is?
Okay, so I think the first thing to kind of perhaps clarify is there is a lot of critique around PSA testing, and it's not specifically around Asian people. It's just not a great test for someone who doesn't have symptoms regardless of ethnicity. And as I mentioned in the talk, and that is because you may have cancer and have a normal PSA. You could have a high PSA and don't have cancer. And ultimately, you may have cancer, but that would never have caused you an issue. We know from lots of studies that lots of elderly men die with having prostate cancer in them, not because of prostate cancer. And so we can open up this Pandora's box of unnecessary investigations and so on. So the converse is we don't really have anything better at the moment. And I'm sure in time, medical advances will create something that can better screen males for prostate problems. The challenge we have at the moment is the PSA is the best thing we have. So as I said in the talk, its main role is if you have symptoms. So certainly if you have waterwork symptoms, a PSA test is a must. If you don't have symptoms, then yes, you can speak to your GP. You are entitled to ask for one, and we can, with discussion, offer you one. But there are some pros and cons to that approach.
Okay, great, thank you. You mentioned also in the presentation around there are certain risk factors around requesting a PSA as well, and one of them was, you know, you mentioned about if there's somebody who in the family who's under 60 who's had prostate cancer, then we're more at risk in that situation. I was just wondering, is there any reason why you specified under 60? So if I had a relative, for example, who was over 70 when they were diagnosed, am I still going to be at an increased risk?
That's a very sensible question. So generally, because of how common prostate cancer is, it tends to be a condition of older patients. So your scenario that you provided, Sanjay, of someone who has a relative over the age of 70, that's actually very common. Lots of individuals, if you inquire into their family history, will probably have a relative over the age of 70 with prostate cancer. What gets more worrying is in the younger patients. Now, 60 is what's often quoted within the NHS guidance, some guidance still within NHS settings, and local consultants in Manchester, for example, say below the age of 65. So there is some flexibility as to what we truly define as a younger patient. But ultimately, the point that we're trying to get across is simply having a family history of prostate cancer in itself isn't that worrying because of how common it is. The younger the history is, the more potential there is for that to have a bit of carrying an increased risk for you as the individual.
Okay, great, thank you. This one, I guess, can go to either of you, really. I've seen some recent advertisements for breast cancer awareness, and they're encouraging men to check themselves too. So obviously this webinar today was about men's health, but they thought it was very interesting and they never thought that breast cancer would impact men. So do either of you have any comments or any experience with that at all?
I'm happy to start, and Harshul, feel free to chip in. So male breast cancer does exist. It's far less common. I think my understanding it's around 1% of all breast cancers occur in males. So it's clearly far less common than breast cancers in women. Ultimately, the advice would be if you feel a lump in that area or notice any change in that area, a rash that isn't resolving, changes with the shape of the nipple or kind of inversion, those sorts of or lumps in the armpit area. These are all kind of warning symptoms potentially for something else going on. And so seek advice from your GP. Again, as a GP, any patient, male or female, who has a new unexplained lump in that area, suspicious lumps in the armpit, they would automatically be referred on an urgent basis to the breast clinic.
Yep. I'd probably extend that to general lumps and bumps. There's a whole variety of lumps and bumps that you can feel, but particularly around the head and neck area, in the armpits and the groins, you'll commonly feel lumps and bumps if you're feeling under the weather. But if there's lumps and bumps when you're not under the weather, it's sometimes worth getting those checked out.
Okay. I think the last one we've got is around, again, touching on mental health. And I think you covered it a little bit earlier on when we looked at stress versus depression. And it's difficult to know what's normal and when to seek help. I don't know if there's anything else you wanted to mention about that at all.
I mean, as I already mentioned, it is normal to feel up and down. It is normal to feel sad or down or lack of motivation or have a few nights of bad sleep because you're stressed at work and things like that. But it isn't normal to feel like that long term, over weeks and weeks, especially when whatever may have triggered that feeling has settled down. It's not normal that you should go and try and do activities that you might enjoy, be it going out for dinner or, speaking to friends, those kind of things should still give you some level of enjoyment, even when you're stressed, even when you're feeling a little bit down, But if you're trying to do those things, or you're now struggling to get up and go for that walk that you used to do every day because you just don't feel like it, or you're struggling to even want to go and spend any time with friends and family, it may be that there is something else underlying and something else going on. And that's when you really want to go and have a chat with somebody, really, because these things shouldn't last for time on end.
Perfect. Great. Thank you both. Just before we wrap up, I'll put you on the spot both just a little bit. Is there have you got any kind of final closing comments or really sort of key messages you'd like to close with before we just wrap up the whole webinar? I'll give both of you the opportunity if there's anything you want to mention. Key messages.
So for me, I very much encourage all of my patients to make use of online resources. The NHS website is full of very useful material, and we've signposted throughout today's session to a number of online resources. Use them, and ultimately, if you have ongoing questions, or you're worried, or you have symptoms, then seek medical advice. There's still a lot of misunderstanding around accessing healthcare at the moment and about GPs appointments. Yes, they are hard to come by, but we are fully open. Book in to see us and we can advise you further.
Yes, likewise, along the same pathway, really. If there are any mental health conditions or any mental health concerns that you have, speak to somebody in the first instance, family, friends, anybody, that you can get hold of that's willing to listen. But often, if you're feeling isolated, you're not sure on your own, then you can always take a friend, and seeking medical advice with somebody to support you isn't a bad thing. And equally, as I've mentioned previously, all men don't have to feel like they're superheroes all of the time. Sometimes it's okay to have to call on a friend and speak up, because it is necessary. 5,000 suicides a year in men is something that's avoidable if we just support each other. So lend hand, lend an ear, and help each other. Can't say any more than that.
Brilliant.
Thank you.
Yeah, thank you both. So yeah, just like to say again, thank you to everyone who's been involved with the webinar so far. So I'd like to thank the presenters. I'd like to thank Mum for the intro at the start. Again, Professor Thampy, Dr. Measuria, thank you for your presentations and your really good answers to the questions as well. I'd like to thank Swami for the opportunity to share about this important topic and to raise awareness. I'd like to thank the media team and also our viewers. I'd like to thank Dr. Upadhyay and the healthcare team as well for all their support and encouragement for us putting together this topic. You can find out more about Movember if you want to at movember.com. And if you want to raise awareness, it's 1st of November, so there's plenty of time to grow a Mo if you'd like to do that. And also, if you have any questions following the webinar, please feel free to email us at healthcare@srisatyasai.org.uk. And we hope finally that you can join us for the next health webinar, which will be on Tuesday, the 6th of December. Good night, everyone. Jai Sai Ram.